This is Dr. Emer in West Hollywood, and somehow it always ends up being Filler Friday. Although we do have a lot of surgeries today, we're doing one of our favorite new treatments. And like I said, the trend for 2019 is having a really structured and defined jawline. For women, it's sleek contour, it's really tight, it's a little more elongated and slender. For men, it's a little bit more of a wider jaw, much more projection in the back, and a lot of definition. So my patient here, we've done some contouring for. He's a very good looking guy, and what's happening now is we're building his jawline. So if you look here, he already has this 90-degree angle and a nice width and projection to his chin, definition in his cheek. Overall, he's fully facial balanced. It looks great. And now we're just building upon that. And we've done this slowly over the course of a few years, building using Bellafill. If you guys take a look, Bellafill here, I always call this the spider web filler because there's a little particles in there and they all stick together. I don't want to waste too much of it, but I'll show you guys a little. You see here that little bleb. That little bleb goes into the skin and becomes collagen over time. So what we're going to do is we're just going to do a maintenance treatment. I'm going to feel where the edge of his jaw is. Go ahead and bite down. So you can see right here where that 90-degree angle is. We're going to go right into that 90-degree. Go ahead and relax. And we're just going to place a little bit of that material. Now we're going to place a little material above and a little bit to the side. And just so you guys who are watching know, I'm going to be lecturing tomorrow in Pasadena to numerous physicians about facial sculpting. We're going to be doing a live demo of this type of treatment as well, but because this is one of the things that we specialize in. And what we're doing is really just building it. Now what I want to do is really define this more laterally. Right here. So hold on. Let's keep these separate. We're going to switch now, adding a little bit more. We're going to do a couple syringes each side. Now probably what I'll do, just to balance everything, is do, and I'll show you guys in a second. We're just building that out. And it always looks a little bit more now and then it settles down. Bite down. Great. So you see that 90-degree becoming much more prominent. Really good. Let's press that. And now what I want to do is, when you build out a guy's jawline, you want to keep that 90-degree angle and a nice definition. But one thing you want to do is just a little poke right above in the superior portion of the cheek. Just a little bit, because that balances out the projection there. Now we're going to go to the other side. Oh good, that's great, even better. So you see just a little bit, even though it's not what the primary focus is, 0.1, 0.2, it's not a lot of material, just to give that definition and structure to his entire face. It just brings it all together. Bite down again. So you can see it's building. Great, relax. Perfect. So now that's done. Go ahead. Your gauze, your gauze. So you can see, take a look at one side versus the other. Go ahead and look straight. Look up with your chin. Good. Bite down. Show them the difference. Projection here. Not as much projection there. A little lift here. Still lifted because it looked good before, but just a subtle change. Now we're going to go to the other side and balance it out. Turn this way. Good. Same thing. Bite down so we can feel perfect. We're going to go right into that 90-degree angle. And again, this filler is very different than others. It's a collagen carrier, so you have to have skin test to make sure you're not allergic to it, because it's one of the only fillers in the US. Actually, I think it's the only one that has collagen still. And some people are allergic to collagen. It's a very small proportion of the population. So you have to have a skin test beforehand. Good. Great. And then the other thing is, you see an immediate bulk, and then it goes down a little bit. Bite down again. Great, relax. That bulk will go down, and it will build over the course of the next years, up to 10 years even. Okay, and the key with this is just making sure you do micro aliquot injections. We do little bits over time because this acts as an implant. Good. And again, like I said, I always want to save that 0.1, 0.2 once we get to this point of the jaw building. Great. Right there, and then almost done right here in that superior portion, just a teeny bit. Now obviously, if If he didn't need it, I wouldn't do it, but just a little. We'll give that little extra bit. It actually balances the jaw. So now, take a look straight. The reason he's bleeding more, you guys, than normal is Bellafill has to be injected with a larger needle because otherwise it won't come out. So we just hold pressure. Typically people don't even really bruise. I'm just gonna wipe it down, clean it off so everyone can see and we can show him. But that's facial balancing and also masculine contouring, which is great.
Can you use a hyaluronic acid filler for the same procedure?
You can use any filler. The reason we're using this one on him is he wants long term. Like I said, we've been doing this for a few years, and over the course of a year or two, he's basically built a jawline that he would have gotten with an implant, which would have been a big surgery. So take a look.
Looks great.
What were you looking to achieve? Oh, that looks really good. Now
Looks
see,
really
I want
good,
to
yeah.
show you something.
Mm-hmm.
So you see that right there gives the illusion of this being even wider.
Right.
And so that's why that little teeny bit in this portion here, but not laterally because that's feminine, in this superior sort of medial, I call it superior portion of that zygoma, balances the width of the jaw there.
Yeah, looks
What were
great.
you looking to achieve?
Masculinization, like you did.
Perfect. So that's it. So we
Yeah, you
got
did.
it. And now we'll build it over time, but that's Bellafill for jawline contouring, guys. Bye. Yeah, that's good.